Hello and welcome to Maternal Mental Health Awareness Week, where this is our 10-year anniversary, where we're celebrating with our theme, A Decade of Voices. And today, for our information session, I am really delighted to be joined by Yvonne Farquharson. I hope I said it right, from our friends at Breathe Melody for Mums. Hello,
Hi, thanks so
how are
much for having
you?
me on. I'm great, thank you. How are you?
I'm really well, thank you. I was just saying in our pre-chat that we were just so delighted when you reached out to see if you could do something with us, and equally at the same time, we'd reach out to see if we could do something for you. And we were just talking about how we love shining a light on organisations who are doing really wonderful things to support parents in the perinatal period. And you do such wonderful work. And I thought if we dedicate half an hour a day to what you do, so people at home can look at options that are there to support their recovery, that would be really lovely. So with that, I just thought I'd hand over to you, Yvonne, so you can introduce yourself a little bit, and then we can get into a chat.
Yeah. Hi, well, thanks so much for having me. As you said, I'm Yvonne Farquharson. I'm the founder and managing director of a small not-for-profit organisation called Breathe Arts Health Research. And our flagship programme is Breathe Melodies for Mums, which works to support women in that postnatal period who are struggling with postnatal depression. But not through your usual means. We use singing as a way to really support their mental health and well-being.
And that's one of the reasons that we thought for a decade of voices, this would be so nice to talk to you. Over the last few years, when we've done these information sessions, we sometimes look at the core basics. What are the symptoms of postnatal depression? How do you talk to your healthcare professional about your symptoms? What do you do if they're scaring you? What are your recovery options? But also, we've shown a light on the organisations that are doing brilliant creative things to support people. And this is one of them. So I just want to say thank you very much. It's just, I think the work that you do is wonderful. Before Yvonne and I go on to talk, you'll have seen this in the caption before this session started. This session is for information purposes only, and anything that we say here should not replace any of the individual advice you receive from your healthcare professional, be it your doctor, your GP, your health visitor, perinatal mental health team, or any consultants that you're working with. And so with that, let's go on. I want to talk about Breathe Melody for Mums. So, in a nutshell, at the beginning, what is it? What do you do?
So, Breathe Melodies for Mums is a 10-week group singing intervention specifically designed and tailored for women experiencing postnatal depression. So, we work with mums whose babies are under a year old at the point that they need support. But we know that there are lots of barriers to women accessing traditional support sometimes through mainstream healthcare pathways, although obviously they offer brilliant routes as well. But we know sometimes shame, fear, embarrassment. Sometimes women don't even recognize that what they're feeling is postnatal depression. And actually getting through the door to your GP or your healthcare worker can sometimes be one barrier too many for women getting the support they need. So we recognised that there was an area where women needed support that weren't necessarily accessing mainstream healthcare. So we've designed a programme that uses singing to improve the mental health of mothers. And while that might sound slightly alternative or a bit wacky, what we can say at Breathe Melodies for Mums is we've now got around 8 years of scientific research behind the programme. So we don't just hope that it works. We really know, and we know on a scientific level, that it is improving symptoms of postnatal depression in mothers in a very clinically significant way.
Thank you. And I think one of the things that I really love when I look through the work that you do, and I think is really important when we talk about this, because it comes up so much in the perinatal period. Often we hear women say there was so much focus on the baby. There
Mm.
was so people say, but you've got a healthy baby, that's all that matters. I certainly remember being told things, along those lines. And one of the things that I think is really empowering from the work that you do is that the focus being on the mother. And I thought, can we go a bit more into why is it important to shine a spotlight on the health of the mother and the support we can give her?
Yeah, absolutely. So, first of all, we believe it's completely essential that the spotlight should be on the mother in that early period of having a new baby for many reasons. There are so many changes for the mother, as you know, physically, emotionally, mentally, socially, their whole world changes. Yet, as minute a new baby is there, everybody's focus goes straight onto that baby. And we know there's loads and loads of mum and baby groups out there. But we also know that the focus of most of those mum and baby groups is also the baby's ability to thrive or learn or get to their next milestones. But actually, we want to put the focus on the mother. We know that postnatal depression cases are very high, around 1 in 8. We know in COVID they were higher. We know many are unreported. They're probably even higher than that. Um, and it's just really important for us when we know also things like suicide can be one of the leading causes of maternal death in that first year after birth, that it's not just a nice to have that women get help and support. It's absolutely essential. So what we've done is we've taken the kind of model of a mum and baby singing group that we know women quite easily will access a mother and baby singing group. But instead of the focus being on the baby, all of the focus is on the mum, which is quite an unusual concept actually for you as a mother, because you're not used to that in those early days. So you wouldn't find in a Breathe Melodies for Mum session any of the singing that you might expect to find in a traditional mum and baby group, for example. So I always say it's a nursery rhyme free zone. There'll be no wheels on the bus. And actually, the singing repertoire that we've chosen has actually been really specifically designed to meet the needs of women struggling with postnatal depression. So I'll give you a few examples. First of all, we sing songs in multiple languages from all around the world. That's absolutely essential. It means you don't have to be able to speak English or have English as your first language to be able to access our programs, which is really important from an inclusivity perspective. There's another reason to it as well. There's something around having to learn a new skill in the moment that keeps you quite cognitively present in the room. So we know that women struggling with postnatal depression can quite often have whirring minds. In fact, all of us can. The amount of time that we're physically present in what we're doing in today's society is very rare. So if we teach songs to women that they don't know in multiple languages, they have to be present in the room, which acts as both a distraction and a sense of mindfulness, which is really important to give them a mental health break, for example, in their day. In addition to that, we really challenge the women artistically. So you don't have to be able to sing to come to our programs, but I absolutely guarantee you that you will sound brilliant in the sessions, because we encourage women. We teach songs that are simple but not easy. So, but we do challenge them artistically, and quite often we're singing in 4-part harmonies by week 4, 5, 6. And when the women hear that back and hear that they've learned a new skill, that they sound brilliant, that is also excellent for their confidence, their sense of self-worth and well-being. And another kind of intricate design element of the program is that we sing songs in rounds. So we know that when you sing a song in rounds, you have to look at the person in the eye who you're in the round with, because it's quite hard to concentrate when other people are singing alongside you. But we know women with postnatal depression can quite often withdraw from social connection and struggle sometimes with eye contact. So actually, if they're encouraged to use eye contact through song, that kind of breaks down those social barriers and really helps to build really meaningful relationships amongst the women. And we also choose songs with lyrics that help to uplift and empower the women, help them realize they're the strong, fierce women that we know they are, even if you don't feel it every minute of the day. And we also choose songs that help women to kind of let go, actually, and release emotion. And we always say at the beginning of our sessions, this is a safe place for babies to cry and for mums to cry. You know, there's no shame in singing and letting your emotions out and crying. So the kind of repertoire of songs, although as a woman entering our session, from your perspective, you're just coming to sing and that's what we want. The actual kind of decade or so of design that's gone into this program has been very, very specifically to meet their needs at that point in their life.
That's so interesting. So I remember with my son, when I came out of a psychiatric mother and baby unit and I came back to our house, I went to our local children's centre and I went to every single baby group going, baby sensory, baby sensory, baby rhymes, baby French, everything. And I think I like my repertoire of jelly on a plate and the wheels on the bus. And you just, you think, and I met wonderful friends there, but I think what you're talking about is so important. This focus being on the mum, but also finding camaraderie, and actually this new skill, I think, is something that I hadn't even considered before, because there's a real pride in yourself when you learn a new skill as well. And I think that kind of that focus on you're going to do something for you.
Yeah,
Your babies can come along with you, but you're doing that for you. It's so different to the fact that when you go to a mother and baby group, actually it's baby and mum group, isn't it? You're going to, I used to plonk my baby down for this baby massage, and then it would be, you know, I'd be in the background, whereas this, you're putting the focus on the mother. And I think that's so important. And something came into my head. So in America, they have a yearly campaign called Climb Out, where women walk long distances, climb out of the darkness that they were in into the light of recovery. And one of the songs that they had a few years ago was Fight Song by Rachel Patton, I think it was, and you think of really empowering, kind of song. And I think there was a real force behind that. And I think that's why something like this is so important. But I wanted
and
to reflect a bit on, oh, no, please go,
I
go,
was
go.
going to say, we know as well that a lot of mum and baby groups can be really hyper stimulating for both the baby and the mum at a point when the mum is already feeling completely overstimulated and very stressed at many points. So we really try to kind of challenge that as well with the groups, and we create very like calm, joyful and calm spaces. But we had somebody come along to one of our sessions recently and interview one of the mums afterwards. And they said, they started and they said, so are the songs great for calming your baby? And I couldn't have written her response better myself, because she just looked at him a little bit confused and then said, no, they're great for calming me. And you think, yes. And she said, and if I'm calm, my baby's calm. And actually what we do is we upskill the women to have these songs in their repertoire, that when they're making a cup of tea or, doing something else, even if the baby's not there, they can sing these songs. We know that it calms their nervous system. They've been designed and chosen for that reason. They can have a toolkit for themselves to self-calm their own nervous system at this very, very challenging period of life.
Actually, I'm so glad that I stopped speaking and let you say that, because I think it ferries me into my next question, because you're talking about how doing something to calm. And I know that recently you've completed a 5-year study on things to do with cortisol levels. So I thought, if I could pass over to you to give a bit of insight into that and what that means about the biology of stress with mum and baby.
Yeah, absolutely. So our program is based on two quite major research studies. So the initial research was carried out by Royal College of Music and Imperial College London back in around 2017, 2018. And that looked at this group singing intervention alongside play sessions and care as usual. And what that found is that by participating in the singing group, it was reducing symptoms of postnatal depression by 35% in just 6 weeks and by 40% in 10 weeks, which is really groundbreaking findings. We've then gone on to do another 5-year scientific research study, this time in partnership with King's College London and University College London, looking at not just the 10-week intervention, but now post-intervention, we're following women for as far up to 6 months post-intervention. And what we've found is we've taken saliva samples from mothers and babies. And in our saliva is cortisol. And cortisol is our stress hormone. It's that hormone that kind of kicks in when you're in fight and flight mode. And we've seen the same replication of cortisol levels dropping and a reduction in symptoms of postnatal depression, exactly mirroring what the initial study said. But this time we can also prove that at 6 months later, the women who took part in the singing group are still experiencing a reduction in those symptoms, showing that this isn't just a kind of short-term hit in time, but actually group singing in this setting can have long-term benefits on the mental health of mothers. And another really interesting finding that's come out of this most recent study is that we've seen that both mother and baby cortisol levels started to synchronize over the 10-week period. Now, what that's showing us is that's a kind of biological manifestation of mother-infant bonding. So we know kind of historically for hundreds and thousands of years all over the world, women have sung to their babies and felt that sense of kind of connection and bonding. But now scientifically, we can show that that's actually happening biologically when you're singing to your baby. So it's so fascinating that we can now prove the reduction in cortisol, the reduction in symptoms of postnatal depression, the long-term benefits of singing in this setting, and the impact on their baby. And the final kind of strand to that research also looked at the cost effectiveness of this programme. So if, for example, our National Health Service was to commission this as a new service, rather than it being seen as a kind of community grassroots initiative, what would be the benefit? And this is proven now to be a cost effective as well as a clinically effective new service for women. So our big hope is, with this huge array of data collected over 8 years with randomized control trials and amazing academics and scientists leading it, that we could put forward a really strong case to our National Health Service and say, actually, let's give women choice over their care. We don't say that you shouldn't go for other forms of care. We really advocate for that, actually, that every individual needs something different. But there could be medication, there could be talking therapies, there could be Breathe Melodies for mums. What if that could just become a standardized offering? Because we've got the evidence to now show, yeah, it's both clinically and cost effective, and it really works, and it's a lot of fun.
Well, the thing is, so in my day job, I'm really social research and stats, so I love all this. But the reality is, because data is evidence, and so you've got your data in terms of your stats, you've got your anecdotal evidence, you've got your quantitative, your qualitative, it's all pulled together. And I think that leads me to my next question, because I think the stats you've just said with the 30% and 40% are unbelievable, because we know, like you've said, 1 in 8 people experience symptoms of perinatal mental illness. We also know from the numerous reports that are printed each year, that have the same messaging, just since I started doing this work in 2014, that so many women are falling through the gaps. One of those reports was called Falling Through the Gaps. And we also know, like you said at the very beginning, in the first year after having a baby is the most vulnerable time in a woman's life, and maternal suicide rates are incredibly high. And that is still a harsh and stark reality, that we are living with. And I think one of the things that you talk about so openly and so well is that we know people experiencing postnatal depression, and actually indeed other elements of perinatal mental illness, really struggle to ask for help, and with the barriers. And we know, particularly with things such as perinatal OCD, where some of the symptoms are particularly scary, people really struggle to ask for help and don't feel like they're in a safe environment to be able to open up. But one of the things I think I'm really interested in is that we know those barriers are there, and quite often clinical settings are barriers to people accessing help and support. And so I think you've answered part of my question already about, how this could help support recovery. But I think I'm interested in how a creative setting like yours could help remove some of those barriers for people who are particularly really frightened.
Yeah, absolutely. Well, we know, as I said, kind of historically in the history of time all over the world, it's considered normal, whatever that word means, to go to a singing group with your baby. We know that women are more likely to walk through the door into a mum and baby singing group than they are to knock on their GP surgery and ask for help. Therefore, taking that model that we know in society already exists socially for women to access, and yet we've designed it in a way that it's meeting all of those clinical needs. We know that is breaking down the barriers for women. And we see it. We see it day in, day out, week in, week out, when women access our work, because there are many, many different ways you could access a Breathe Melodies for Mums programme. Some women are referred from a healthcare worker. We actually deliver these sessions in mother and baby units as well. So sometimes women who come out of a mother and baby unit then come into the one in their local community. We get midwives referring. We have all of those networks within our healthcare system, and they're essential. But another really huge element of accessing our work is self-referral. Seeing something about our work on Instagram or on Facebook, or having, we turn up where women are at. You will find my team out in the local community, at hairdressers, at faith-based groups, at breastfeeding clinics, actually meeting the women where they're at and saying, we know it's hard to get out the door. We know it's hard to kind of get on a bus and get to a session. We'll come to you to tell you about this and tell you about the benefits of this work. And I think the other reason it kind of works to break down barriers is, although in the sessions we don't actually talk about postnatal depression, although the whole program is around postnatal depression, every woman who walks into that space knows that every other woman in that setting is struggling with postnatal depression. There's the unspoken knowledge that you found that tribe. Maybe it's not the tribe you wanted. You didn't want to be somebody who had that label of postnatal depression, but you suddenly realize this is common. Everybody here, they're like me. You thought this was going to be a period of your life and hasn't quite gone to plan yet. but there's an unspoken knowledge that we're all in it together. And that's a very different environment to having to turn up at your GP on your own and admit this. That said, as a local organisation, we do signpost women back into those mainstream healthcare services. So we have really strong connections with the children and family centres, with local GPs, healthcare workers, midwives. And actually, we just see ourselves as one part of a much more holistic wraparound care, because women need more than one level of support at this time in their life. And I guess what our programme does as well is it helps to create those peer support networks, that when that 10-week has ended, there are friendships there. There's a woman down the road who you sung with for 10 weeks, who you know gets you and gets what you're going through. And many of the women say they become their friends for the rest of their life.
This is so lovely. And I think when you find your tribe, there is nothing quite like it. So the women that I work with here in the partnership, we found each other through Facebook groups and Twitter. I mean, this is a long time ago,
Yeah.
before things, changed, and we realized what an awful platform that was. But I think, and we've come together because of our joint experience. And I think what you talk about so beautifully is that how the work that you do at Breathe Melodies for Mums breaks down barriers, brings people together. And I think the next thing I want to talk about is how it helps to bridge the gap between mum and baby.
Yeah.
So we've talked about how singing can bring mums together, finding their groove. We've talked about the support it can give in terms of recovery to a mum. But how does the singing bridge the gap between a mum and her baby at what can be a really, really difficult time?
Yeah. Well, again, we kind of equip women with a toolkit, a way to engage with their baby when they sometimes don't know how. They don't know, should they be speaking to their baby? What should they do with their baby? We have chosen songs that they can sing to their baby, and the song can be their language. And we say to the women, it doesn't matter what you sound like when you sing, because for your baby, your voice is the most beautiful thing they know. So actually, however you think you sound, to your baby, you sound perfect. And we know a lot of women struggle to just naturally know what to do with their child. So in this space as well, we quite often give some kind of gentle direction of how they might be able to, through a certain song, engage with their child, or certain movements, or to lift their child at a certain point, or touch them on the nose. Or we kind of filter this into some of the music, but never so much that it also detracts from the fact that the music is for the mums. And actually, just by the mums singing and their baby being nearby, the baby is benefiting. And scientifically now, we can prove that. And there's something really powerful about singing that's been kind of measured scientifically as well. And it's perhaps more how kind of women interact with women, but there's no reason it doesn't also filter down to babies. But it's something called the icebreaker effect. So we know that singing is a better icebreaker as a social bonder than kind of play as usual, or usual care, or usual ways of engaging. So we know that it does that scientifically. That's been proven. So that can work on a peer-to-peer level, but also there's no reason to think in many ways that couldn't filter down to the baby as well.
So if someone is at home now watching this, so we've talked about how people are referred to you. If someone's sitting here thinking, this sounds wonderful, how do people access your services, and where are you based, and what should they do? But also, indeed, these sessions are not just watched by women at home who are unwell, family members who are supporting. These are watched by healthcare professionals, and they open up a new world to them when they think there are other kind of referral routes available to them. So if somebody is at home thinking, I want to be referred, what area do they need to be in, and what's the first thing they do?
Yeah. So the first thing to do would be to go on our website, because on our Breathe Melodies for Mums page, it lists all of the kind of physical locations where groups are taking place. Now, at the moment, that's predominantly in London, but that's because, unfortunately, we live in a world where it's a postcode lottery, and you have to go to every single commissioner to get that kind of commissioned on a borough by borough basis. But we recognise that this has to be available for everybody. So therefore, we have online versions of this programme that are open to every woman, no matter where you are. So if you look on our website and you think, oh, I don't live in Lewisham in southeast London, that's okay. You're still eligible. You can still take part. And through our scientific research study that we did with King's, because that actually ran over the period of the COVID pandemic, we actually monitored an online version of the program and did the same scientific research for those women. And we know that taking part online has the same benefits as taking part in person. So you wouldn't need to think, oh, that's a kind of lesser option if I take part online. We're also at the process now where we're doing a lot of advocacy work. So we're in the position where we're looking to roll this out nationally as a new service offer for women across the UK and beyond. And we've also been working with the World Health Organization to roll this out into other countries. So now we've trained teams in Italy, Denmark, Romania, Switzerland, Singapore.
Really?
Yeah. So
Oh
there's
my,
around 7 countries across Europe and Asia where you can also access this work. So we're getting there. It's not perfect. We're not kind of existing in every borough yet, but I can absolutely guarantee you that's not through want of trying. We're knocking on every commissioner's door. We're writing funding applications all the time, because one thing that's actually really, really important to us at Breathe Melodies for Mums is we want this to be an entirely free programme. And people have said, you know, you can charge, mum and baby groups charge, but we don't want to. We know there are enough barriers to women to accessing help without adding a financial barrier on top of that. So for that reason, it takes longer to roll it out because we're fundraising hard. But please know that if you are struggling right now, we have online groups available and we would love to hear from you. And we're working so hard to make it happen in your local area as well.
like my next question was going to be, what does the future hold for Breathe Melodies for Mums? But I think you've answered that. This has blown me away. So I do work with Postpartum Support International and do an awful lot of work with people across the globe. And of course, during this awareness week is World Maternal Mental Health Day as well. So it fills my heart with absolute joy because I did not know this, that you're working with so many people in so many different places. And I think you talk so beautifully about having the barrier always removed of money, because I think that's one of the reasons that we started the week. We wanted it to be a free resource for people globally of things they could tap into. And I think we know where we are at the moment. Last year, one of our theme days was around how financial implications, costs of things can have a real detrimental effect on maternal mental health. You know, when you're pregnant, thinking you haven't got the money to buy a cot, which are
Yeah,
£400, buggies at £800. I mean, I can't even get my head around these things. Adding up a bit of money here and there for mother and baby groups that you're going to, because you know, like being around other people is going to get you out of the house. You
yeah,
know, it's going to fill your day with things when you're scared of being on your own with your baby and those kind of things. Having the barrier of money when you're only on between maternity pay or you don't have any money at all, it can be really, really overwhelming. And I think last year, working with organisations who support people financially, it really opened a lot of people's eyes, you know, but actually every penny counts at
yeah.
what is the most vulnerable time, you know, in a family's life. So I think running a programme that has that barrier removed is another sigh of relief, you know,
Mm.
for parents at home. I think you've answered all the questions that I had, Yvonne, about the programme, which sounds so innovative, but also the science behind it shows why it works and how it works. And we do know that it does work. So before I say goodbye to you and thank you, is there anything else that you'd like to say about the work that you do?
I think just one final thing is obviously around the future of the programme. So one element is we want this to be rolled out nationally. We want it to be funded by our National Health Service or statutory funding. So if there is anyone listening who, you know, is a commissioner in a local area or works at a children and family centre and wants to get in touch, we're here, you know, we're listening and we're really advocating for this work. So please reach out. And the other thing to say is I know this is around kind of maternal mental health, but one of our most recent kind of next steps of the programme is that we're now piloting it for dads as well, because we know that actually dads and partners can also really struggle in that period. And the next step beyond that is to look at LGBT families. We know in today's society, families aren't a mother and a father. It's so rarely that, in fact, anymore. And actually, it can be a whole range of setups across kind of sexuality, gender, different family members taking part. And we want to really recognize that as we develop the program to the next level. And within that network of struggling with kind of mental health, we want to create kind of tribes within that so everybody can find their community and everybody can get help.
This is wonderful. Thank you so much for the work that you do and for graciously taking your time and guiding us through the work of Breathe Melodies for Mums. It's been a pleasure to have you part of Maternal Mental Health Awareness Week, and I thank you for the work that you do.
Oh, thank you so much. It's been such an honour to be here and so great to chat with you who are doing amazing work. So massive thanks from us right back to you.
Oh, thank you. Bye, everybody.